All right, you ready? All right, good evening, everyone, and thank you for being here. We are here to update the public on the progress of discussions with the Chicago Teachers Unions on CPS's plans to expand in-person learning options for students and parents. Throughout COVID-19 crisis, our primary focus has been on saving lives. And we have never deviated from our equity-focused, data-driven approach. You've heard me say many times in these last 10 months, and there have been no easy choices, and that remains true. And when it comes to our schools, we have used the same data-driven equity focus. Our students, their families, and the entire school community deserve no less. I am personally grateful for the school-based staff who have been in CPS buildings throughout the pandemic. The cafeteria workers, the janitors, the assistant principals, the principals, and others. I also want to commend the teachers who chose to come back into buildings last fall, even before we created a pathway for students to return. And of course, I commend the pre-K teachers and the cluster teachers who have returned to support students in their in-person learning. As CPS built its plan for giving parents options for in-person learning, the singular mission has been to use every means at our disposal to provide every single one of our students the safe instruction that is right for them, whether that instruction takes place in person or at home. And when we talk about safe, we mean rooted in the data and the science of this disease that ensures the safety and protection of our students, our teachers, our school staff, and the entire CPS community. The same hard-nosed, transparent, rigorous, community-driven public health standards that we have applied to every aspect of our city's response to this terrible pandemic. And led by our incredible Public Health Commissioner, Dr. Allison Arwady, who is here this evening. An integral part of that effort has included constant, and I want to underscore constant, and ongoing engagement with the Chicago Teachers Union to reach a mutual, science-based, data-driven agreement that serves to support our kids' education and their futures. CPS has demonstrated its good faith by, since June, meeting with the CTU leadership over 60 times. And in the last 2 weeks, virtually every day, including weekends. Meeting or exceeding the CDC and Chicago Department of Public Health guidelines on health screening, temperature checks, hand sanitizers, disinfectant wipes, face coverings, PPE, regular cleaning, disinfecting protocols, and social distancing. Enhancing ventilation upgrades, including the purchase of HEPA air filters for all classrooms and office spaces, and contact tracing. In addition, we have agreed to expanded surveillance testing for students and staff, creating a specific plan for vaccinations of teachers and staff, particularly those in the hardest hit areas of our city where we continue to see high case rates and high positivity. And expanded accommodations for those teachers and staff for whom in-person instruction is not appropriate, either because they have their own personal underlying health conditions or they're the primary caretakers for someone who does. And while I hope that we can, after all of this effort, reach an agreement, I will tell you that I am deeply disappointed that after all this time, all these sessions, all the work to make sure that our CPS schools and buildings are safe, no agreement has yet been reached. And this is true despite weeks of daily evidence, 3 weeks of daily evidence that our schools are safe. Let me remind you that 3 weeks ago, pre-K students and cluster students, our special needs students, returned to in-person learning. And we have built a school environment that has kept them safe. Now, let me be clear. We will stay at the bargaining table and keep working because we always put our children first. There is no question that students are persevering, but there is also no question that there is no substitute for in-person learning. And as you've heard me say now many times, too many of our children, particularly our Black and brown kids, are falling behind. And I have to tell you, ladies and gentlemen, that I fear for their future. Unfortunately, we also have to bring you the news that the CTU union's leadership has made it clear that despite the data and science confirming the safety of in-person learning in our schools, they have determined that pre-K and cluster teachers should not report tomorrow. Now, our pre-K and cluster staff, obviously, we do not expect them to violate the directive of their union, and they will not be in class tomorrow. And we owe it to our parents and our students to tell them that, therefore, we have no choice but that they should not send their children to school tomorrow. This is a great disappointment. And for now, remote learning for all students will continue. But to be clear, we fully intend on continuing our plans to open in-person learning for kindergarten through 8th grade students beginning this Monday, February 1st. I want to reiterate a couple of points. We have been at the bargaining table every day for the last 2 weeks and working on this issue diligently with CTU since June, and we will continue to do so. Our fight is a fight for equity. Equity for our kids, for their families, and for their future. We cannot, and I cannot, as mayor, in good conscience, as a mayor, as a mother, and a proud resident of this city, leave these students behind who are failing, when a safe solution is absolutely possible. Again, 3 weeks of proof within CPS. And we have a body of evidence of other schools here in Chicago that have had some form of in-person learning since September. Dr. Jackson and her team at CPS have done the Lord's work, make no mistake about it, in ensuring our kids and entire school communities are in fact safe. They've worked night and day to successfully develop safe solutions for in-person instruction and finding ways to safely apply it throughout the system. This is the same approach we use to safely reopen our businesses and public spaces across our city. This is the same approach that over 130 schools in Chicago, 2,000 daycares have used to provide safe in-person learning for their students and their families. And in the case of daycares, they have been open since June. This approach is especially urgent when it comes to the education of our kids and the next generation of our city. As I said, I am deeply concerned for them. Education absolutely is the great equalizer. And we see the data. Too many of our kids are falling woefully behind. And as a result, leaving them seriously disadvantaged now and in the future, which is a challenge that we will meet. But we need to meet it by providing a pipeline and an opportunity for parents who believe that this is the best option for their family to bring their children back into in-person learning. It's interesting that today, as we are speaking, the CDC put out additional guidelines talking about the precautions that can be taken in schools to keep kids safe, and that in-person learning, where it can happen, should happen. It's consistent with the new administration's efforts to return students to in-person learning and providing additional supports to make that happen. And I want to say again, as I've said many times before at this and other podiums, I understand and hear the concerns of teachers who are fearful for their health during this pandemic. I do. I understand and I hear you. Just as I understand and hear the concerns and fears of the daycare workers, the factory workers, the healthcare workers, the grocery store and construction and transit and sanitation and other workers whose jobs do not allow them to work remotely and to stay at home, who have to get out there every day to risk and sacrifice so that they can provide for themselves and their families. I hear and see you too. Teachers, of course we want you to be safe. Of course we take your health and safety incredibly seriously. And we have built a plan to make sure that you can get the vaccine. But we need you to work with us. We need you to talk to your leadership, because we can't get there unless we get there together. And we need to get a deal done for our children to provide them with certainty, safety, and stability that in-person learning affords all of them. At this point, I'll turn the podium over to Dr. Jackson.
All right, good evening, and thank you, Mayor, for those remarks. I just want to start my remarks tonight by building on this concept of equity. Earlier today, I had a chance to meet with parents from the far South Side who shared their struggles that their children are facing due to being educated during this pandemic. And they shared their concerns and how they made decisions about whether or not they would send their students back to school on February 1st. This is a decision that no parent takes lightly. But we also know that many of our students are struggling as a result of their inability to be educated in an in-person setting. The parents that I spoke to today deserve and need options, safe options for their children. And that's why we've been dedicated for months now to put together a comprehensive plan that guarantees the health and safety of our students and also prioritizes safety for our teachers. As an educator and a CPS mom, I am greatly concerned for our students and families that have already dealt with so much adversity. As the mayor noted in her comments, our team has been meeting with CTU for months now, trying to reach an agreement that prevents the very disruption to learning that many students are going to be facing starting tomorrow due to the union's decision to direct teachers to stay home. Despite meeting over 60 times, we find ourselves in a place where union leadership has determined that the staff and students who have been safely learning together for the past 3 weeks in our classrooms should suddenly stop. Earlier today, we provided union leadership with a comprehensive proposal which addresses most of the concerns that they have been talking about. The mayor talked about some of these in her remarks, but I'll go a little bit deeper. We have made a commitment to expand surveillance testing and telework accommodations for staff to prioritize vaccinations in our hardest hit communities. We believe that our latest proposal to the union can serve as a foundation to a deal. Frankly, there is no good reason why we shouldn't have an agreement at this time right now. Under our new proposal, we're also going to increase the amount of rapid COVID testing for school-based employees to twice a month. We will also begin offering free monthly COVID testing for students who attend schools in zip codes with the 10 highest zip codes with COVID positivity rates. And when the district begins receiving vaccines directly from the federal government, we will also be prioritizing staff who work in those hardest hit communities. The union has also demanded additional medical and caretaker accommodations for telework, and the district is prepared to offer as many accommodations as possible while also ensuring that we can safely instruct our students and give them the quality education in the classroom environment they deserve. We have also agreed with the union leaders to create district and school level health and safety committees so that we can ensure that the proper mitigation strategies and measures are being implemented consistently and with fidelity across our schools. Finally, we have proposed clear guidance for when a classroom pod, a school, or the district should revert to online learning. Under our proposal, school public health officials once they establish that transmission has occurred across 3 separate pods and contact tracing cannot attribute it to an isolated incident, a school will revert to online learning for 14 days. Should, at the district level, in-person learning may be suspended if the district's positivity rate reaches 3% as established by our surveillance testing program. Should that occur, a joint CPS-CTU surveillance testing committee will make a recommendation to the CEO and union president to determine if the district should revert to online learning. While we have not reached an agreement yet, we all agree on major health and safety protocols in a number of other areas and still continue to believe that an agreement is close. I am in touch with district leaders across the country, and I can honestly say that our plan goes above and beyond many of the health and safety aspects that I've seen. We have invested over $100 million in things like face coverings, HEPA filters, as well as our testing and contact tracing program. I cannot name many school districts, if any, that have gone above and beyond in the way CPS is planned. We've done this because we know that we can safely operate our schools. Private and parochial schools in Chicago have been operating since the fall, and students in schools have lower rates of COVID-19 transmission than their peers who are not receiving in-person learning. And as the mayor pointed out, just today, the CDC issued new research that makes it crystal clear that schools can operate safely even when community transmission is high. Our top priority remains to provide in-class options for students and families that choose to do so. We remain steadfast in our commitment to return to in-person learning on February 1st, next week. But as it stands, union leadership has directed pre-K and cluster staff not to report to school tomorrow. And despite our calls for them to report to work as expected as their employer, we have no other choice but to inform parents that they should not bring their children to school to ensure their safety. As the mayor pointed out, we remain hopeful that we reach an agreement soon, and we also remain steadfast in our commitment to reopen schools next week. We will now take your questions.
Thank you. I realize that the vaccine is limited supply, but there are several questions about why can you not reprioritize, come up with a standard protocol, and get the teachers vaccinated? They're getting them vaccinated. I get it. It's smaller suburbs, like Skokie has already vaccinated theirs. Smaller schools have done it, private schools. But I think many people would say, let the teachers go, top of the line, let them in there. Why is there not a standard protocol for teachers?
We do have a plan for vaccinating teachers, and as we said, prioritizing those teachers in those communities that have been the hardest hit by COVID. But in 1B, we also have others who have been out there every single day, working, putting themselves at risk. And we have to also prioritize those folks as well. I named some of them: the frontline workers, grocery workers, sanitation workers, our librarians, a whole panoply of other workers that have also been out there every single day throughout the pandemic working. How do we say to those folks, you have to go to the back of the line? We want to prioritize teachers. We will prioritize teachers, but we have to do it in the context of a plan that is data-driven and focused on, first, those areas, those workplaces, those jobs that are at highest risk. That is the fair and equitable thing to do, and that's what we're going to do.
CTU has reported there have been 60 cases of COVID since January 11th. Is that correct?
That number's about right. Can I speak?
Go ahead, sure.
Yeah. Yes, that number sounds about right. I also want to remind people that we do publish all of our COVID cases online on the CPS website to ensure transparency. But what I would also say about that is we can't guarantee a COVID-free environment. But what we have guaranteed is that we have a strong plan in place that mitigates the spread of COVID. And so what we have planned for is exactly what's happening in our schools. When cases arise, we're able to isolate, take pods into quarantine immediately to make sure that COVID is not spreading in our schools. And to date, we have not had to close a single school due to outbreaks of COVID-19. So I think our teachers and our principals that have been operating with children for the past 3 weeks have been doing exactly what the guidance has said, which is being safe, doing the health screeners, taking temperatures, paying attention to the testing, and when people are made aware that they have COVID-19, reporting that so that we can isolate people immediately and mitigate the spread of COVID.
The CTU has,
Hold on one second.
sorry.
Dr. Arwood
Yeah.
wants to weigh in on this question.
I can add just a little bit. So again, it's not that we don't expect to ever see a case of COVID in a school, because we know that COVID remains in our community. The question is whether being in school itself is a risk for acquiring COVID or COVID transmission. And so while we have certainly seen cases, just as we've seen cases in the archdiocese schools and the private schools around the country, when we do the investigation, this is why you do the contact tracing. You look and you say, did this person potentially get exposed in a school setting or not? And in the great majority of these cases, I can't say 100%, I haven't seen this data, but what we have consistently seen is that these are not cases of transmission within school. Where there is a case, there's a protocol. And so that pod would need to quarantine. We follow for 14 days and we test if there are issues, if there are problems, and the huge majority of the time, we do not see an additional case. What we have learned is that when we see multiple cases in school, the most common reason is because there are two siblings who attend a school, or a parent and a student. One may be a teacher, one may be a student. Vanishingly small numbers where we cannot rule out transmission within schools. And that does include people who are, we've asked people to report any of their COVID cases, regardless of whether there's been exposure. So I just want to put a little bit of a finer point on that. It's not that we won't see COVID. It's that just like the CDC and so many other studies over and over again in Chicago, across the country, around the world, with the precautions in place that CPS has in place, we do not see schools serving as a significant source of transmission. We do not see them driving community spread. We didn't know that a year ago, but it's one of the things we have the best data on now, and we would not be recommending moving ahead with school reopening if we did not have every confidence and reams of data that help make that decision one that's based in the public health science.
Would CPS agree to a mediator as CTU has asked for tonight?
Well, Dr. Jackson can correct me if I'm wrong, but we agreed to that in November. We said we would do it and asked them to follow up, and they did not. So if they're back with the mediator, we're all for it.
From Sarah Karp, at what point do you consider this a strike?
Well, I don't want to speculate, and we're not there yet, but we're concerned, no question about it.
Does this, continuing, does city and CPS need to declare the union's action a strike in order to go to court and get an injunction?
Well,
Is
again-
this on the table?
Again, I don't want to speculate about a place that we're not at yet. We should be getting a deal done. There's no reason, as Dr. Jackson said, after all this time, all this effort, the robust plans and procedures that we have offered, and 3 weeks of data that demonstrates that the plan that CPS put in place are actually working, that we should not have a deal done. We're at the table. We will continue to be at the table. We want to get something done.
From Chalkbeat, will the district move to lock out teachers who, oh, wait, you've already said that. Excuse me. What does the district see as the main sticking points with CTU?
Well, look, I think the biggest issue that has recently arisen, and I will say, unfortunately, there's been some goalposts moving along the way, and hopefully we're past the non-education issues like defunding the police, like having CTU dictate affordable housing policy in the city, assuming we're not talking about those issues anymore. I think the biggest issue is staffing, about what more can realistically be done to accommodate people who don't have an underlying condition themselves and are not the primary caretakers of people in their households that have those conditions. So we remain committed to try to work through this, but we've got to do it in a way that doesn't leave classrooms devoid of teachers. And the second issue is the one that we talked a little bit about before, which is vaccinations. And should every teacher get a vaccine, both doses, before they have to come back to in-person learning? Again, poses significant staffing challenges. We cannot have classrooms where there are no teachers. So we are hopeful, and I think we put together a proposal that addresses some of those issues, but we have to have a willing partner on the other side of the table.
From A.D. Quigg at Cranes, do you have any immediate legal recourse in response to the union opting to go all remote? How quickly can you take that effect?
Apparently, a lot of the reporters want to play lawyer and mix it up in the courtroom. We're not there yet, and I hope we never get there.
The mediation proposal was agreed on the front end. That is, from the union, I'm hearing this anyway, just now. And that is hostage taking, not mediation, according to them.
I don't even know what that means. Okay, I don't know what that means, and I'm not gonna roll around and exchange rhetoric. What I know is our kids need to have the option to come back to in-person learning. We're committed to getting a deal done, and we should get it done at the bargaining table.
From Nader Issa from the Sun-Times, Dr. Jackson, you said in a webinar last month that you were disappointed with decisions you'd seen across the country to reopen bars and restaurants ahead of schools. Mm-hmm. How do you feel about Chicago opening its bars and restaurants this week as CPS tries to get back into the classroom?
I think the mayor has prioritized school reopening. The plan that we put out, we agreed upon that back in November and made that clear. And in all of my conversations, with the mayor, she's been clear that schools are a priority. I think we all learned a lot comparing things from the spring to today. But I don't think those two comments cancel one another out. I was disappointed and remain there. We live and we learn, but the mayor has shown her commitment to reopening schools, and we're on the pathway to do so.
Okay, from Sarah Karp, why will CPS not release the demographic information of the 20% of preschool and special ed students who are attending? If this is about equity, why won't you show proof that low-income Black and Latino students are being served by this reopening?
We can provide that data, but let's be clear, that argument, I'm not even going to keep debating that argument. I think I've spoken on that time and time again. The vast majority of students in Chicago public schools are Black and Latino. The vast majority of students whose grades are falling, being impacted dramatically by COVID-19 are Black and Latino students. If people don't see that as an equity issue, I really don't know what else to say.
Some are going to misread this, that, the teacher, it's such a volatile issue. But the teachers seem to really have you on this. Mm-hmm. And there's a lot of people it's divided. I shouldn't say a lot. Mm-hmm. It's divided over, why not take the teachers to the mat on this? I say that as a former teacher, teachers out there that are going to be mad at me for saying this. Yeah. But why not take them to the mat on this and try to open these schools without the union? Because there's parents at home that are texting me and saying they're just completely frustrated.
No, listen, I'm hearing from those parents. Yep. I'm hearing from those parents. This is a very big issue. You've heard me say this before. Our goal is to grow the population of this city. A clear issue that a lot of families talked about is, what's the condition of the schools? Are they safe? Are they good? Are they stable? We're 1 year removed from a 5-year teacher's contract, and yet here we are again. And this instability and chaos serves no one. It doesn't. And least of all, our children. Least of all, our families. Least of all, our efforts to turn the corner and move in a different direction as a city. We won't get there, ever, with this happening. So I hear you, parents. I've seen the emails you send me. I've seen the comments that you paste on social media. I understand the frustration, and we are doing everything that we can to make sure that we get this deal done. And, as you've seen from the questions, there's a lot of speculation of what if, what if, what if. Why don't you fight? Why don't you take them to the mat? We've got to put our kids first. We've got to put our children first. I go to bed every night. I wake up every morning worrying about the fate of our children. And schools are such an important part of who they are, a community's identities, a family's ability to strive and reach beyond their current station. If schools are constantly in turmoil, there's always a threat of a strike looming on the horizon. How do we plan? How do we give people confidence that CPS stands for the values that I know it stands for, that I know most teachers stand for? How do we accomplish that when we have this level of chaos? You know, we have the benefit of having a new administration at the federal level, one who sees cities, who wants to partner with us and values who we are. A president who has set, I think, an incredible standard already and has prioritized supporting schools, getting them reopened, because he knows, as we know, that education absolutely is the great equalizer. I stand here as living proof of that. My family didn't have anything, but what I had was parents, and particularly my mother, who emphasized the importance of education, and thank God she did. I feel an obligation to give that back to every single student, particularly one who look like me and are growing up in circumstances like mine. This isn't helping them. It's hurting them. It's hurting them.
Thank you, Mayor.